As you know, I'm the Minister of Defense.
Reggie White came out of the USFL where they said there was nobody around who could block him.
If you recall back in 2004, Reggie White, arguably the greatest lineman ever to play the game, he passed in his sleep. He had other underlying cardiac issues, but he had severe sleep apnea.
More than 18 million adult Americans currently have sleep apnea, a condition that causes them to stop breathing in their sleep because their airways shrink sometimes to the size of a pin. Common signs include sleeping with your mouth open, snoring a little, or a lot. And while it may sound funny, physicians like Dr. Shehzad Malik say the end results may not be a laughing matter.
There's a higher chance of you having a heart attack. There's a higher chance of you having a stroke, whether it's a mini stroke or a major stroke. There's a higher chance of you developing high blood pressure that's difficult to treat.
Studies show when you have sleep apnea, your brain and heart can never fully rest. Plus, lacking oxygen periodically excites the heart and circulatory system, which can lead to heart issues.
And the reason why we talk about Reggie White so much is because when you study Reggie White or you study any player in the NFL, you see a large-size individual with a large neck circumference. And so he likely stopped breathing God knows how many times that night. Probably was struggling to wear a breathing machine, or what they call a CPAP machine, for days, maybe months, maybe years at a time, and then one day he doesn't wake up.
After White's death, doctors made it a point to ask overweight and people with large necks about their sleep patterns.
We became very good at asking all those questions in a large-size individual. And we sort of forgot or didn't think that this same problem can happen to me. And I'm not a big guy and I got a thin neck, or to you, or to a teenager, or to a baby, or to really anyone, irrespective of gender or ethnicity.
To find out how many people actually have sleep apnea, doctors across the country started conducting sleep studies, a test patients can either take in the hospital or in the comfort of their own homes, just by wearing a simple device. And the results were astonishing.
We're getting numbers as high as over 90%. In fact, out of the over 1,000 studies we've conducted, close to 35% of these patients are severe, which is astounding. 25% are moderate, 30% are mild, and the rest are normal. And if you do the math, that's not a lot of normal patients in our practice.
Dr. Malik says the numbers are an indication there needs to be a deeper conversation in the exam room.
So every doctor in the United States, whether they're a pediatrician, obstetrician, gynecologist, internal medicine doctor, family practitioner, even a psychiatrist, they need to ask people about what's happening to them when they sleep at night. When doctors ask, they ask you how you're doing, because they're seeing you now in the daytime. Are you having any chest pain? How are you feeling? Here's your meds. Here's your prescription. I'll see you back in 6 months. Tell them to slow down. Ask me about my sleep. Ask me if I'm snoring at night. Am I breathing properly at night? Is anyone noticing that there's a problem? Is my mouth open at night? They'll be surprised at the answers that they get.
Hi, I'm Shirley.
And I'm Regina Mitchell. For more videos like this, subscribe to WHYY.